Vertigo is a sensation of spinning or dizziness, where you feel like you or your surroundings are moving or rotating, even though nothing is actually moving. It is a common symptom that can be caused by various underlying health issues, often related to the inner ear or brain. Types of vertigo. There are two main types of vertigo. Peripheral vertigo. This type of vertigo is caused by problems in the inner ear, which controls balance. The majority of vertigo cases are peripheral. Benign paroxysmal positional vertigo (BPPV), a common cause of vertigo where tiny calcium crystals in the inner ear become dislodged, interfering with the balance system. This type of vertigo is triggered by specific head movements. Meniere's disease, the disorder of the inner ear that causes episodes of vertigo, along with hearing loss and ringing in the ears, tinnitus. It's linked to abnormal fluid buildup in the inner ear. Vestibular neuritis/labyrinthitis, inflammation of the inner ear, usually caused by a viral infection, can lead to vertigo along with nausea and sometimes hearing loss. Central vertigo. This type originates from problems in the brain, particularly the brain stem or cerebellum, which help control balance. This type is less common and more serious. Stroke. A stroke affecting the brain stem or cerebellum can cause vertigo along with other neurological symptoms. Multiple sclerosis (MS). This neurological condition can affect the brain and spinal cord, leading to vertigo. Migraines. Some people experience vertigo as a symptom of migraines, known as vestibular migraines. Tumors. Rarely, brain tumors affecting the balance centers in the brain can cause vertigo. Causes of vertigo. Vertigo can be caused by a variety of factors, which are often related to issues with the vestibular system, a complex system in the inner ear and brain that controls balance. Key causes include inner ear problems. Peripheral vertigo. Benign paroxysmal positional vertigo (BPPV) occurs when small crystals in the inner ear become dislodged and interfere with balance sensors. The vertigo is usually triggered by specific head movements. Meniere's disease, caused by an abnormal buildup of fluid in the inner ear, leading to vertigo, hearing loss, and tinnitus, ringing in the ears. Vestibular neuritis or labyrinthitis, inflammation of the vestibular nerve or labyrinth, often caused by a viral infection, can result in sudden vertigo, nausea, and sometimes hearing loss. Brain-related causes. Central vertigo. Stroke. A stroke in the cerebellum or brain stem, areas involved in balance, can lead to vertigo. Multiple sclerosis (MS) can damage the brain's balance centers, causing vertigo among other neurological symptoms. Migraine. Migraines, especially vestibular migraines, can trigger vertigo, dizziness, and sometimes balance problems. Brain tumors. Tumors that affect the areas of the brain that control balance can cause vertigo. Other causes. Head injury. A concussion or injury to the head can lead to vertigo or balance issues. Ear infections. Infections in the ear, particularly in the inner ear, can lead to vertigo as a symptom. Dehydration or low blood pressure. Dehydration, anemia, or a drop in blood pressure can sometimes cause dizziness or vertigo. Medications. Some medications, including certain antibiotics, sedatives, and blood pressure drugs, can cause vertigo as a side effect. Symptoms of vertigo. The main symptom of vertigo is the sensation of spinning or movement. However, the exact experience of vertigo can vary, and people might describe the feeling as feeling like you or your surroundings are moving, dizziness or lightheadedness, nausea. Vertigo can often be accompanied by nausea and vomiting, particularly if the vertigo is severe. Loss of balance. Difficulty standing or walking can occur, as vertigo often affects balance. Tinnitus, ringing in the ears, can accompany some types of vertigo, particularly in Meniere's disease. Headaches. Some people experience headaches along with vertigo, especially with vestibular migraines. Diagnosis of vertigo. The diagnosis of vertigo often begins with a physical exam and a detailed history of the symptoms. The healthcare provider will ask questions about when the vertigo occurs, how long it lasts, and whether it's triggered by certain movements. Tests to help identify the cause of vertigo may include Dix-Hallpike test. This is a common test for diagnosing BPPV. The doctor will move your head in specific positions to trigger vertigo and check for characteristic eye movements. Nystagmus head impulse test. This test involves moving the head in different directions to check the inner ear's response and assess for vestibular dysfunction. Hearing tests. These can help identify issues like Meniere's disease or other inner ear problems. MRI or CT scan. If a stroke, tumor, or other brain-related condition is suspected, an MRI or CT scan may be recommended to rule out structural issues in the brain. Blood tests. These can help detect infections, anemia, or other underlying health conditions that may contribute to vertigo. Treatment of vertigo. The treatment for vertigo depends on the underlying cause. In many cases, vertigo can be managed with non-invasive treatments, although more severe cases may require medical intervention. For peripheral vertigo, e.g., BPPV, Meniere's disease epilepsy maneuver for BPPV. This is a specific series of head movements performed by a doctor or therapist to help reposition the dislodged crystals in the inner ear that are causing vertigo. Vestibular rehabilitation therapy (VRT), a form of physical therapy that involves exercises to help the brain compensate for balance problems, particularly useful for people with ongoing vertigo symptoms or inner ear issues. Medications. Antihistamines e.g., meclizine or anti-nausea medications can help reduce symptoms of vertigo and nausea. Diuretics may be prescribed for Meniere's disease to reduce fluid buildup in the inner ear. Corticosteroids may be used to reduce inflammation in cases like vestibular neuritis. Lifestyle changes. Avoiding triggers. For people with Meniere's disease or vestibular migraines, avoiding triggers such as certain foods, caffeine, or stress may help manage symptoms. Dietary changes. In Meniere's disease, a low-sodium diet may help reduce fluid retention in the inner ear. For central vertigo, e.g., stroke, MS, treating the underlying cause. If a stroke or brain tumor is causing vertigo, immediate medical attention is necessary to address the cause. In cases of multiple sclerosis, disease-modifying therapies may be used to manage the condition. Medication for migraines. If vertigo is related to migraines, medications to treat migraines such as triptans or beta blockers may help manage the vertigo symptoms. Physical therapy. Vestibular rehabilitation can also be beneficial for central causes of vertigo to help improve balance and coordination. For other causes, hydration. If dehydration or low blood pressure is causing vertigo, drinking fluids and addressing the underlying cause, e.g., treating low blood pressure or dehydration, can help relieve symptoms. Antibiotics or antiviral medications. If an ear infection or vestibular neuritis is causing vertigo, appropriate medications can be prescribed. When to seek medical help. While vertigo is often benign and resolves with treatment, it is important to seek medical attention if the vertigo is sudden, severe, or comes with additional neurological symptoms, e.g., difficulty speaking, numbness, or vision changes which could indicate a stroke. The vertigo is accompanied by hearing loss, which may suggest a condition like Meniere's disease. Vertigo does not improve with usual treatments or persists over time, indicating the need for further evaluation. Prognosis. The outlook for vertigo depends on the underlying cause. In many cases, vertigo resolves with proper treatment or management. For example, BPPV can often be treated successfully with maneuvers like the epilepsy maneuver. Vestibular neuritis or labyrinthitis may improve with rest, medications, and vestibular rehabilitation therapy. Conditions like Meniere's disease or vestibular migraines may require ongoing management to control symptoms. If vertigo is related to a more serious condition, such as a stroke or brain tumor, prompt treatment and management are essential for a better outcome.